Mrs. Jones, I just want to go over one last topic that the doctor asked me to bring up and educate you on that he left out when he was in. Have you ever heard of a deep vein thrombosis, which is also known as a DVT? So, a DVT is very important to know about post-operative in patients. How to get it, how you would get it, ways to prevent it. There's a critical importance in understanding this complication, not only for you, but for the healthcare team that's caring for you as well. So I'll give you an analogy. A deep vein thrombosis can resemble a gridlock in a bustling metropolis, right? So similar to a traffic jam, deep vein thrombosis can lead to pooling and clotting in the veins, particularly the legs. So this can lead to serious consequences, such as a pulmonary embolism. If it dislodges and travels to the lungs, it can kill you. This is a very serious matter. I want to explain the key manifestations of a DVT. So this can include swelling, pain, tenderness in the affected leg, warmth to the touch, and changes in the skin color. So we want to watch for all of that. It's important to be vigilant in monitoring these signs and symptoms, especially after surgery, because your mobility will be more limited than before surgery. So to prevent a DVT, there's two common interventions. The first thing we're going to do is we're going to try to get you up and out of bed and moving as much as possible. So early ambulation helps promote the blood flow and reduces the risk of clot formation. Utilizing SCDs or compression stockings. These will help maintain the venous return and prevent blood from pooling in the legs. So that's those machines that'll kind of feel like a massage, and it'll pump up on one side and then pump up on the other. That's very important. I know a lot of people don't love having them on, but if you're in too much pain to get up and get moving, it's very important to wear those. Now, in terms of medication, we're going to prescribe you what's called an anticoagulant, also known as a blood thinner. This can be heparin, warfarin, Lovenox. We'll prescribe this to you to prevent further clotting and manage existing clots. I would explain these medications work as in terms of thinning the blood and reducing the risk of complications. So there's a huge importance of me educating you right now and you understanding the potential complications of post-operative surgery, and just following through, making sure you fully understand and have a better grasp on some of the complex concepts. It'll help you easily and make you feel empowered and recognize symptoms early on so we don't miss anything. I strongly suggest in the days to come you should keep a little notebook or pad or something next to your bedside, and just while you're sitting here overthinking, as we all do, I want you to write down any questions that you might have for the doctor, because when they come in, it can be quite overwhelming. You have sometimes a team of people that you're meeting for the first time because you don't remember them from surgery, and they're giving you all this information that's crucial and important, and then you forget what you wanted to ask, and you forget to ask questions about certain things. So keeping a pen and pad at bedside, I tell all my patients, is very important to do. So this way you have everything written down, and then while they're talking to you, you could write things down as well. And it just really does help understand things better and remember what you want to talk about. So that's it. I'm so glad you took the time to listen to me. If you have any further questions or need anything further, don't hesitate to ask. I'm going to give you these pamphlets and brochures, and I want you to read up on this and other complications that might arise that you could watch for as well. Okay, so you have yourself a great day, and if you need anything, you ring the bell.